Hi everyone, and in this video we're just going to demonstrate a couple of different adjustments or HVT thrusts for the shoulder. So we're going to demonstrate a couple of different techniques. So one will be seated and two will be with the patient supine or face up on the table. So I hope you enjoy. This technique is another technique while the patient is in a supine position. Again, we have indications for an anterior subluxated glenohumeral joint. So what we're going to do is we're going to ask the patient to place the palm of their hand on the side of the face towards the ear. Place our inside hand, or the one that's closest to the patient, and one that's ipsilateral to the patient. Through the loop that's generated, we're going to go underneath their shoulder blade. We're going to lift it up. We're going to place the contralateral hand, or the hand on the practitioner side, underneath onto the shoulder blade itself, stabilising the shoulder blade. That gives us something to thrust through. We cup our right hand here, in this case, across the head of the humerus, or the neck of the humerus. We try and get the patient to leave the shoulder nice and relaxed. Compress, find that vector of thrust. We ask the patient to leave their elbow nice and relaxed. Find that area where it's a little bit restricted. Pump, 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 and thrust through and cavitate. So in this video, we're just going to demonstrate with the patient in a supine or face-up position. It's an AP thrust towards the table for a anterior glenohumeral in the flat plate of the shoulder blade. So there are other indications and other tests that we would do to determine if this is the issue, but we're assuming that we have this dysfunction, and this is the HVT or HVLA adjustment for that. So for this technique, we would hold the patient's wrist. We would place our thenar eminence across the anterior portion of the shoulder, cupping round the top of the shoulder. I tend to externally rotate as I distract the arm down towards the feet. Then I compress the shoulder back as I internally rotate the hand back towards the patient. So then what we need to do is, while we have this in position, we traction the arm across the opposite anterior superior iliac spine, compress the shoulder, find that restrictive barrier and thrust through. Now this can be done also without the external rotation. So this can also be taught as placing the hand in the aforementioned position, traction the arm down, compress, traction across the opposite shoulder or the opposite ASIS, compress and thrust down towards the table. This technique is an AP thrust front to back while the patient is in a seated position. It's an alternative for the supine positions that we already showed earlier. So what we do here, and this is for the same clinical indications, we have an anteriorly subluxated glenohumeral joint, humerus in the glenoid fossa. So what we can do here is ask the patient to place their hand across the back of their neck or even towards the side of their head. We stand side on towards the patient, so it's this side towards the patient. Again, stabilising. We can ask the patient to sit a little bit closer back towards me. And that just means that I can stabilise their shoulder blade with my side. We place our hand across the elbow, clasping across. We ask the patient to relax their arm as much as possible. And then what we do is we just find that restrictive barrier, and then in a slightly upwards fashion, so we draw the arm across, and in a slightly upwards fashion as we compress, 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 find that restrictive barrier. Once we find that barrier, it's sharp, short thrust upwards. Once that arm is brought across, and again the angle can be slightly different for every person, and thrust. So I hope that helps, guys. So what we've just shown are three different techniques for a glenohumeral adjustment. For an anteriorly presenting glenohumeral adjustment, we've just shown a HVT or a HVLA in three different positions for a glenohumeral thrust. So I hope this helps, guys. We hope you've enjoyed the video. If you like what you see, hit like and subscribe, and we'll try and get some tailored videos out if you put the request in. Thanks for watching, guys.